Hello everyone, welcome back to Serene Soul. Today, we have a very important topic to discuss: cultural and gender considerations in mental health. Understanding how culture and gender influence mental health experiences and access to care is crucial for providing effective and equitable mental health care. So, let's dive right in. Mental health is something that transcends borders, yet the way it is perceived and addressed varies across different cultures. We need to recognize and respect these differences, understanding that mental health is not a one-size-fits-all concept. In many cultures, there are unique beliefs and practices surrounding mental health. For instance, certain communities may attribute mental health difficulties to spiritual or supernatural causes. On the other hand, some cultures may emphasize the importance of community support, where extended family and friends play a crucial role in maintaining mental well-being. However, we must also acknowledge that culture isn't the only factor shaping mental health experiences. Gender plays a significant role as well. Societal expectations, stereotypes, and discrimination can have a profound impact on individuals' mental well-being. Men, for instance, are often discouraged from expressing vulnerability, resulting in higher rates of undiagnosed mental health problems. Women, on the other hand, might face specific challenges related to gender roles, body image, and societal pressure. Transgender and non-binary individuals can also experience unique mental health concerns due to gender dysphoria and lack of understanding within society. Understanding and addressing these factors are crucial for providing effective and equitable mental health care. Here's an overview of the key points to consider. Number 1. Cultural considerations. A. Cultural beliefs and stigma. Different cultures have varying beliefs and attitudes towards mental health. Some may stigmatize mental illness, viewing it as a sign of weakness or moral failing. This stigma can deter individuals from seeking help. B. Cultural expression of distress. Symptoms and expressions of distress can vary across cultures. Healthcare providers need to be culturally sensitive and recognize that some individuals may express their psychological distress differently. C. Language and communication. Language barriers can hinder effective communication between patients and mental health professionals. Access to interpreters or culturally competent providers is crucial for accurate assessment and treatment. D. Cultural values and coping mechanisms. Cultural values, such as collectivism or individualism, may influence how individuals cope with mental health issues. It's important to respect these values while providing support. E. Cultural competence. Mental health professionals should undergo cultural competency training to understand and respect the diverse backgrounds and needs of their patients. Number 2. Gender considerations. A. Gender-based differences. Gender can influence the prevalence and manifestation of certain mental health conditions. For example, depression and anxiety disorders are more common in women, while substance abuse and antisocial behaviors are more prevalent in men. B. Socialization and expectations. Societal norms and expectations around gender roles can affect how individuals express and cope with their mental health challenges. Men, for instance, may be socialized to suppress emotions, making it harder for them to seek help. C. Trauma and violence. Gender-based violence, such as domestic abuse or sexual assault, can have profound effects on mental health. Recognizing and addressing these traumas is essential in providing appropriate care. D. Access to care. Gender disparities exist in access to mental health care. Women may be more likely to seek help, while men may face barriers due to stigma and reluctance to appear vulnerable. Number 3. Intersectionality. A. Multiple identities. Individuals' experiences are shaped by multiple intersecting identities, including race, ethnicity, gender, sexual orientation, and socioeconomic status. It's important to consider how these intersecting factors affect mental health experiences and care access. Number 4. Culturally competent care. Mental health professionals should strive to provide culturally competent care that acknowledges the influence of culture and gender on mental health. This includes adapting treatment plans, considering cultural values, and respecting individual preferences. Number 5. Education and awareness. Raising awareness about cultural and gender considerations in mental health is essential for reducing stigma and promoting equitable access to care. Public health campaigns and community outreach can help achieve this. So, that is the good news. Increased awareness and understanding can lead to more inclusive and effective mental health support for all. By taking a holistic approach that includes cultural and gender considerations, we can bridge the gaps that prevent individuals from accessing the help they need. In summary, what can we do? Firstly, we need to promote open conversations about mental health and break down the stigmas surrounding it. By doing so, we create safer spaces for individuals to seek help, regardless of their cultural or gender backgrounds. Secondly, educating ourselves about different cultural and gender perspectives and how they intersect with mental health can help us become more empathetic and supportive allies. Lastly, we need to advocate for greater diversity and inclusivity within mental health services and research. This means ensuring cultural competency, providing accessible resources, and addressing the unique needs of different gender identities. Remember, mental health is a universal concern, but it's crucial to recognize and address the diverse experiences that cultural and gender factors bring to the table. Together, we can create a world where everyone has access to the support they need, regardless of who they are or where they come from. Recognizing the impact of culture and gender on mental health experiences and access to care is vital for providing effective and inclusive mental health care. Culturally sensitive, gender-informed, and intersectional approaches are essential for addressing the diverse needs of individuals seeking mental health support. And that's a wrap for today. If you found this video helpful or informative, don't forget to give it a thumbs up and share it with your friends. Also, let me know your thoughts in the comments below. Thanks for watching, and until next time, take care of your mental health and stay awesome. Bye.